Anxiety. Understanding its essence, symptoms, causes, and coping strategies. Unveil the art of mastering anxiety and embracing a life of fulfillment. Have you ever experienced that sensation of tightness in the chest, a racing heart, and a mind spinning at a dizzying pace? If so, you have likely encountered anxiety. While it is a natural emotion that arises in the face of challenging circumstances, when it becomes frequent and intense, it can significantly disrupt one's life. In this discourse, we embark on a journey to unravel the enigmas of anxiety, explore its essence, symptoms, the causative factors, and, most importantly, strategies for managing this whirlwind of emotions. Understanding anxiety. From ally to adversary, anxiety, astonishingly, serves as an ally to humanity. Picture yourself confronted by a hungry lion. Anxiety triggers your fight or flight instinct, priming your body to react swiftly to this peril. The quandary arises when this natural survival mechanism becomes imbalanced, morphing into an impediment. Everyday scenarios, such as public presentations or social gatherings, may evolve into sources of intense stress, fostering a perpetual sense of apprehension. In this context, anxiety ceases to be an ally and transforms into an adversary, hindering one's ability to fully engage in life's richness. Distinguishing anxiety from fear. A matter of intensity, it is crucial to differentiate between anxiety and fear, for they are two distinct emotions. Fear is an immediate response to a real and imminent danger, triggering an instantaneous protective reaction. For instance, feeling fear upon encountering a venomous snake is a natural response to avert danger. On the other hand, anxiety entails an apprehension regarding a future threat, often exaggerated or unfounded. It is characterized by excessive worry about events that may or may not come to pass. For instance, persistent concern about the possibility of losing one's job, even in the absence of concrete evidence, is indicative of anxiety. Warning signs. Recognizing the symptoms of anxiety. Anxiety can manifest in various forms, encompassing physical, emotional, and behavioral symptoms. Discerning these signs is paramount to seek appropriate help and treatment. Some of the principal symptoms include physical symptoms:
tachycardia, rapid heartbeat,
perspiration, excessive sweating, shortness of breath, muscle tension, tremors, nausea, dry mouth. Emotional symptoms: excessive worrying, restlessness, irritability, anguish, fear of losing control, difficulty concentrating. Behavioral symptoms: avoidance of anxiety-inducing situations, social isolation, difficulty sleeping, changes in appetite. If you resonate with several of these symptoms, do not hesitate to seek professional help. The sooner the diagnosis is made, the sooner you can commence treatment and reclaim your quality of life. Unraveling the mysteries. Causal factors of anxiety. The origin of anxiety can be multifactorial, influenced by a combination of genetic, biological, psychological, and environmental factors. Some of the key factors that may contribute to the onset of anxiety include genetic predisposition. Individuals with a family history of anxiety are more prone to its development. Chemical imbalance. Alterations in neurotransmitter levels such as serotonin and dopamine may contribute to the onset of anxiety. Environmental factors. Traumatic events, financial difficulties, family conflicts, and chronic work stress are some environmental factors that can trigger anxiety. Lifestyle habits. An unbalanced diet, deficient in nutrients, and poor sleep quality can exacerbate anxiety symptoms. Medical conditions. Some health problems, such as hyperthyroidism and depression, may be associated with anxiety. Understanding these factors can aid in the treatment and management of anxiety, enabling the adoption of effective strategies to cope with the condition. Strategies for conquering the challenge. Anxiety can be likened to an emotional roller coaster, brimming with peaks and valleys. Nonetheless, overcoming this challenge is attainable through various tools and strategies aimed at managing symptoms and restoring mental equilibrium. Seeking professional assistance. The inceptive step towards triumph. The quintessential first step in confronting anxiety is to seek professional assistance. Specialized professionals can provide appropriate support and guidance in coping with emotional challenges. Among the most common professionals to assist in anxiety treatment are psychiatrists, a specialist in the diagnosis and treatment of mental disorders. The psychiatrist can prescribe medications when necessary, as well as offer psychotherapeutic guidance. Psychologist. The psychologist plays a pivotal role in the anxiety treatment process. Through psychological techniques such as cognitive behavioral therapy, CBT, they aid in identifying and modifying thought and behavior patterns contributing to anxiety. Therapeutic approaches. Allies in the battle against anxiety. In addition to seeking professional help, there exist several therapeutic approaches that can be efficacious in anxiety treatment. Some of these include cognitive behavioral therapy, CBT. CBT is a proven therapeutic approach in anxiety treatment. It centers on identifying and modifying dysfunctional thought and behavior patterns, assisting the individual in developing more adaptive strategies for coping with stressful situations. Complementary therapies. In addition to traditional therapeutic approaches, various other complementary therapies can be utilized to address anxiety. Some of these include mindfulness, a technique that teaches you to focus on the present moment, fostering awareness and acceptance of your thoughts and emotions. Yoga, a practice that combines physical, breathing, and meditative exercises, aiding in stress and anxiety reduction.
Relaxation technique.
Diaphragmatic breathing, meditation, and progressive muscle relaxation are effective tools for calming the mind and body. Lifestyle changes, paving the way to wellness. In addition to therapeutic approaches, it is imperative to adopt a healthy lifestyle to effectively manage anxiety. Some lifestyle changes that can aid include nutritious diet, consuming nutrient-rich foods with a low glycemic index, while avoiding caffeine and alcohol, contributes to physical and mental well-being. Restorative sleep. Getting 7 to 8 hours of sleep per night is essential for the body and mind to recover from stress and anxiety. Regular physical exercise. Engaging in physical activities that you enjoy helps release endorphins, hormones that promote well-being and combat anxiety. Stress management. Identifying stress triggers and developing coping strategies are crucial measures to reduce anxiety. Healthy coexistence with anxiety. Learning to dance with the roller coaster. Lastly, it is important to learn to coexist healthily with anxiety, developing strategies to deal with it on a daily basis. Acceptance and self-compassion. Acknowledge anxiety without judgment and practice self-compassion, treating yourself with kindness and understanding. Strengthening the social support network. Seeking support from friends, family, and support groups can be very helpful in sharing feelings and experiences. Setting realistic goals. Set small, achievable goals, avoiding overwhelming yourself and celebrating each achievement, no matter how small. Practicing gratitude. Focusing on the good things in life and practicing gratitude daily contributes to mental and emotional well-being. Although anxiety is a natural emotion, it can become an obstacle to a fulfilling and happy life. By recognizing the signs, seeking professional help, and adopting healthy habits, you can learn to cope with anxiety and control it. Do not hesitate to seek help. Psychiatrists and psychologists are trained professionals who can assist you on this journey. With dedication and the right strategies, you can overcome anxiety and reach the pinnacle of your mental health. Remember, you are not alone in this journey. There are millions of people facing anxiety, and the good news is that it can be controlled. Take care of yourself, invest in self-care, and live a life with more tranquility and well-being. Frequently asked questions. Question 1. How do I know if I have anxiety? If you experience some of the symptoms of anxiety, such as excessive worry, restlessness, irritability, difficulty concentrating, among others, it is important to seek professional help for an accurate diagnosis. Question 2. Is anxiety curable? Anxiety is not curable, but it can be successfully treated and managed through therapy, medication, lifestyle changes, and other strategies. Question 3. What to do during an anxiety attack? Find a calm and safe place. Practice breathing techniques to calm yourself. If the attack is very intense, seek medical help. Question 4. Do anxiety medications cause dependency? Some anxiety medications can cause dependency, so it is important to follow medical advice and use them responsibly. Question 5. Is anxiety normal? Anxiety is a natural and normal human emotion. However, when it becomes frequent, intense, and interferes with your life, it may be a sign of an anxiety disorder that needs treatment. We have reached the end of the audio anxiety. Understanding its essence, symptoms, causes, and coping strategies. Did you like this content? Share with someone who needs support right now. Anxiety. Understanding its essence, symptoms, causes,